Good afternoon. Nope, sorry, good morning. I apologize. July 14, 2026. We are streaming live spine surgery from Deuk Spine Institute here in Florida. Our patient has neck pain. He had an artificial disc put in at C5-6. We'll show you that in just a moment. Maybe you can move, get another fluoro shot. Take a look at the artificial disc there, Anthony. Can you see the artificial disc?
Yes, I can.
Can you see the white arrow circling?
Yes.
Folks, artificial discs are being recommended to patients left and right by spine surgeons. And the truth is, they're completely unnecessary and should not be put in my opinion. Why put a metal disc in a neck when you can actually repair the disc now with a laser at Deuk Spine Institute? Our version of laser spine surgery here at Deuk Spine Institute, called the Deuk Laser Disc Repair, has a much higher success rate than artificial discs. More importantly, artificial discs cause adjacent segment disease, which is what this patient has. So he traveled here from Nebraska. He's had neck pain for 16 years, had the artificial disc put in Nebraska at the recommendation of his surgeon. And he's had problems ever since. Pain in the neck doesn't go away. He has adjacent segment disease in the facet joints above the artificial disc. And studies have shown time and time again that artificial discs do not prevent adjacent segment disease. So we're going to go in and treat his facet joint pain with our Deuk plasma rhizotomy. The rhizotomy is a procedure shot done to eliminate facet pain. Yep, that's good right there. We're going to start by making a 4mm incision. That's a tiny little cut. No, it's not done. Bring it back. That 4mm incision, got to go all the way through, is basically the entire surgery is done through that 4mm incision. We're going to use our Deuk plasma wand, which is radiofrequency wand, to destroy the pain nerves in his neck that are causing his neck pain. Now, he also has a herniated disc at shot C3-4, and I told him you may need to have that herniated disc repaired as well. So we're going to see how he does with this procedure, but he may have to come back and get that done. All right, any questions, feel free to type them up. In the meantime, let's show the audience how facet joints cause pain and how we fix it. All right, folks, we are in the process of treating his facet joints with our Deuk plasma rhizotomy, which is a procedure we developed here at Deuk Spine because patients kept having radiofrequency ablation, coming back, having the same pain over and over again. Shot. And we found that we had to keep doing the radiofrequency ablations years after years after years. And we could never give our patients permanent pain relief because the radiofrequency ablation would wear off. Shot? If you have questions, feel free to ask. Did you show the audience how the Deuk plasma rhizotomy works?
No, I can play it now.
Shot? Go ahead.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. We're right now in the process of treating this patient's facet joints, and he's from Nebraska. Remember, he had an artificial disc procedure done. You can see that on his X-ray. And once again, I'll have just in a minute Jordan show you that. Are there any questions?
Yes, we have a question from Dom on YouTube.
Dom or Don?
Dom, D-O-M.
Hi, Dom. Nice to meet you. I'm Dr. Deukmedjian. Thank you for joining us. We'll take his question. Sean?
Dr. Deuk, how long is the recovery after levels of rhizotomy in the neck? 3 on each side.
Great question, Dom. Typically, recovery, and just understand something. You guys see the artificial disc right there Jordan is showing you?
Yes.
Okay, it's a metal disc. It was put in Nebraska, where he's from. It's got a keel on the top, a keel on the bottom. Those keels literally fracture your bones in your spine, fracture them. And then they hope that the bone will reintegrate into the keel and stabilize it. In his case, I believe he's got a little bit of implant failure because I see some loosening around his plate, around the end plate. As far as recovery from this procedure, it's typically 45-minute recovery. You may have a little soreness from the procedure for, it could be a week, maybe even 2 weeks at most, but that's typically all. Most patients' pain is gone by the next day. They come in and say the facet pain's gone. But remember, there's also muscle pain, and I cannot get rid of their muscle pain. Muscle pain requires basically exercise after your surgery to get those muscles reconditioned so that they don't get tired and build up lactic acid so quickly. But because the facet joints hurt so bad, people don't move their neck. Because they don't move their neck, they end up getting weak muscles in the back of the neck. We call it atrophy or deconditioning shot. And because of that, what happens is the patients end up with muscle pain after the surgery, not joint pain, because we got rid of the joint pain. They end up with muscle pain. And that muscle pain can last a long time. I had one guy from, I think he was from England or Australia, I can't remember. And that guy, he was like in his 80s. Anyway, we did his DPR. We got rid of his facet pain, but he had muscle pain, and it lasted, it was probably at least a year, right? Because he was so deconditioned. And I tell people, I cannot magically cure your muscles. I can cure your joint pain, but I can't cure your muscles. And so people just have to be patient, and they got to do their walking exercises like I give them. And then, of course, in time, all of that will get better. We got about 2 minutes, 3 minutes maybe, Dr. Berndes. All of that pain will go away in the muscles. All right, Sean, we're just about done in getting in position on this opposite side. We've already done the left side. Is he rotated, Sean? All right. Any other questions?
No questions.
Sean? Sean. Sorry, I'm just focusing on what I'm doing here, which is destroying his pain nerves. Now, has the audience seen how this procedure works?
Yes, they have.
Sean? So we showed them how facet joints get injured and cause pain, and we showed them how we use our Deuk plasma wand to destroy the pain nerves called the medial branch of the dorsal ramus, giving basically a permanent RFA. That's the difference. Radiofrequency ablation is temporary. Our procedure gives permanent pain relief to our patients. Now, as I was saying earlier, he does have another herniated disc further up in his neck at C3-4. We talked about leaving it alone until we get his facets treated. He wanted to wait, and I think that's the best thing to do, wait, and let's see how much relief he gets of pain from this procedure. If he continues to have pain in his neck, then we're going to have to do the Deuk laser disc repair. Any other questions?
No questions.
All right, we're just about finished here. Another minute. I could actually feel the medial branch of the dorsal ramus get cut right there in the back of the lateral mass, which is the bone next to the facet joint. Some of the pain nerves, it's quite amazing, are really thick, and I guess over time, because the pain is so bad, the nerve gets bigger, it gets hypertrophied, which is quite interesting. Nobody's ever described that before. I'm the first person to talk about it, but it's real. And I think just like muscles hypertrophy, ligaments hypertrophy, bones hypertrophy, nerves hypertrophy. And as such, those pain nerves that hypertrophy, well, they're clearly bringing pain signals, right? So we're going to disrupt those pain signals by cutting those big fat pain nerves, which you don't want in your neck, by the way. They just bring pain. All right. Well, I think that does it. Any other questions?
No questions.
Let's leave the audience with the 30 causes of neck pain. What do you think about that?
Yeah, sounds good, yeah.
We'll show you the incision. The incision is 4 millimeters. It's tiny. That's why the recovery for this procedure is so quick, because the incision is tiny, and we're not destroying anything inside his body. We're just destroying pain nerves, nothing else, no muscle, no ligament. Great job, team. Thank you for your support. Any other questions? Thank you, Hector.
No.
Have a great day. We'll leave you with a nice video to explain the 30 different causes of neck pain. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank